So, what's the difference between Six Sigma and NABH?
Okay, that's a very pertinent question. I will just tell you what is NABH. Okay, NABH is National Accreditation Board for Hospital and Healthcare Organizations. Okay, it was initiated uh, in by the Government of India as part of Quality Council of India. Okay, because we wanted the standards of hospital to improve and reach a certain international standard levels. Okay, so NABH was formed to devise standards which the hospital should follow and try to get NABH accreditation. Okay, so NABH has got 10 chapters. On in those chapters there are various standards, and the standards where there are various objectives. Okay, so what NABH means is that the hospital should have certain minimum standards to ensure that the patients that come to the hospitals are provided quality care and safety, right? So when a hospital goes for NABH, they have to form certain protocols, they have to write down certain policies, they have to make procedures, they have to document it, they have to prepare the reports, standard operating procedures, and based on that standard operating procedures, they have to follow the and implement those in the hospital, and they have to train their staff to follow that process. So they have to prepare various SOPs, they have to write down policies, and you have to implement all those protocols and policies inside the hospital, and you have to ensure that all your staff follows that protocols and policies. Okay, it simply means that you have to write what we plan to do, and we should do what we have written. We should write what we are doing, and we should do what we have written. So what do we write? We write the SOPs and policies for everything. Whatever activity you are doing in the hospital, you have to first write it down, and we have to make SOPs and policies. Once you write it, then you train your staff. You write it in discussion with your staff, and once you write it, your staff has to do what is written. Okay, and then this goes on in NABH, and when NABH is an external agency. Okay, and this agency will visit our hospital, and they will check the hospital, they will go through SOPs, they will talk to our staff, they will inspect our premises, and if our hospital is having all the SOPs, policies, and if we are correctly following all those policies, then we will be accredited. That is called accreditation. So accreditation means that somebody from outside is coming, inspecting us and giving us a certificate. So that is NABH, right? And to get that certificate, we have to prepare all these documents, and we have to implement these documents in the hospital, and our staff should be aware of all these programs. Okay, so what is written in NABH chapters is the minimum that any hospital should have. It's the minimum standard that any hospital should have. So that is a minimum standard. Okay, and once you achieve that minimum standard, you will get a NABH certificate. Right? Now, what is Six Sigma? In Six Sigma, the thing is opposite. There is nobody is going to come from outside. You have to find out your problems. You have to take measures to correct those problems, and you have to solve those problems, and you have to improve your quality. That is Six Sigma, right? And everything is internal. NABH is external, Six Sigma is internal. In Six Sigma, what we do is that we identify a problem. If there is a problem, then we use the root cause analysis. Then we do a corrective and preventive action, and we try to we try to remove the problem, and bring the process and protocols to our expected standards. So in Six Sigma we use a tool called define, measure, analyze, improve and control. Right? In define process we identify the problem. In measure process we measure using various tools. Then we analyze the root cause of the problem. Then we suggest improvements by various sessions, and then we bring it to the control level using a control chart. Okay. So basic difference between NABH and Sigma is this: NABH is external, Six Sigma is internal. Six Sigma, nobody is going to give you a certificate on that. You have to generate your own. So in Six Sigma there are various levels called yellow belt, green belt, black belt and master black belt, and champions, like that. There are various levels. So when you train your employees or train your staff, they can go for a yellow belt training, and then some of them can go for a green belt, and some of them who are exclusively into Six Sigma can go for a black belt or a master black belt. So you will have several teams in your organization that will be taking different areas, and they will be trying to solve the problems, and they will correct it and bring it to the expected standards. So in Six Sigma the standards are very, very high. In Six Sigma the standard is 3.4 defects per million opportunities. That means if there are 10 lakh, it means that in a hospital, if you take a problem like patient waiting in your registration, okay, so we want our patients to wait not more than 5 minutes in the registration counter. Okay, that is our target. But we find that patient is waiting for 10 minutes or 20 minutes or even 30 minutes. So this is a problem. So this problem is solved by using this tool. We define the problem, we measure the problem, we analyze, then we suggest improvement and bring it into a control chart. Okay. So then our aim is to bring this problem to reduce it to 5 minutes. Right. So when this 5 minutes we have reached it, okay, to achieve Six Sigma level, if 1 million patients are coming to your hospital, out of that 1 million, only 3 patients should go beyond 5 minutes waiting period. Means if 1 million people are coming to your hospital, only 3 people have waited for more than 5 minutes. That is the Six Sigma level for registration in a hospital. So the same can be applied for any process in the hospital. So Six Sigma can be applied for process and products. Six Sigma was initially applied in the industry, manufacturing industry. It was initiated by MOTOROLA. Okay, but later when we found that Six Sigma can be used for process, it has been brought into hospital sector also. Okay, thank you.